Hello, I'm Lindsay Shepherd and I'm a hypnotherapist. People often ask me if hypnosis is suitable for children. Yes, absolutely. Children have such amazing imaginations and curiosity, so they really are brilliant at hypnosis. And in addition, children, unlike us adults, they don't usually have any misleading or preconceived views about what hypnosis is. And they're eager to discover something new, something interesting, something exciting. The sort of things that hypnotherapy can help your child with are bedwetting, school anxiety, perhaps going on to a senior school, another school, exams, university interviews, bullying, sleep problems, doctor's visits, like needles, injections, dentists, anger, which is quite common with children, bad habits like thumb sucking, nail biting, phobias and fears, tics and twitches, lack of confidence. In general, hypnosis is suitable for children from the age of about 6, although this does depend on each child's individual development. For hypnosis to be effective, a child needs to have a sense of self, know who they are, to be able to listen to and to follow instructions, and to be able to communicate. Before I agree to work with children and young people, I like to meet them first, so that they can get to know me and that I can properly assess if they're going to be suitable for hypnotherapy. This initial consultation takes about 30 minutes and is usually free of charge. During that initial consultation, I will talk to your child, find out what it is about their problem that they don't like, how it's affecting them, and how they would like to feel. Our focus is always on the solution, not the problem. I'll often do some fun demonstrations too. And this helps me assess your child's level of engagement and ability to follow my instructions. And of course it helps us build up that really all-important rapport. And you know, it's great fun too. And of course, I will also discuss with you, the parent, how hypnosis can help your child and to set your mind at rest if you have any questions or any worries. I will ask that your child does some tasks between sessions. I will also teach them self-hypnosis, how to hypnotise themselves. If your child is old enough to take the responsibility to do this themselves, then I will ask that the parents allow them to do just that. If not, I'll show you, the parent, how to help them, just enough, but not too much. After all, your child will be learning self-mastery, how to master and overcome the problem themselves. In my experience, even quite young children, they really enjoy this. Self-hypnosis is safe and it's very effective. I actually consider it an essential life skill. I have a client who was taught self-hypnosis over 30 years ago, when she was a seriously ill young patient in Great Ormond Street Hospital. To this day, she still uses her self-hypnosis skills, especially when she's in new situations when maybe she could be feeling a little bit anxious. That's what I mean about self-hypnosis being a life skill. As a parent, you must be absolutely committed to your child's course of therapy. There will often be quite a fine line to balance, giving your child responsibility to learn self-mastery, but also making sure that they are actually doing the tasks. In the case of bedwetting, you will need to be very committed and very involved and often very patient. For example, I'll ask you to discontinue using night pants and start using mattress protectors instead. The reason for this is because it's essential that your child learns the difference between dry and comfortable and wet and uncomfortable. If your child is all snug and dry, they simply do not know when they are starting to release their bladder. They can't interpret that signal. Of course, there's going to be some washing to do in the early stages. So as you can see, it really is important that parents are absolutely committed and encourage their child all the way. Think about this. I often work with adults who tell me that the phobia they have is exactly the same as their mum or their dad's fear or phobia. So if you think about that, if you have a phobia, your child might just pick up on it and display the same fears. The phobia is not hereditary, it's the environment. And that could just be you. Imagine a child who experiences anxiety, maybe going to a new school, for example. Each day is an ordeal. The anxiety grows unchecked, year by year, until that child becomes an anxious adult. Of course, as adults, we have a lot more to worry about, don't we? Work, mortgage, our pensions. That anxious child is now a very anxious and quite possibly depressed adult. He has taken on that identity. Anxious, fearful, sleep deprived. You get the picture. If that child had had help in childhood, learnt to become confident, learnt coping skills, those self-mastery skills follow all their life. And isn't that just a wonderful gift to give them?
Yeah, super.